Okay, hi. Hello, Sam. Hi,
Hello.
everybody. I'm Yael Saar, and I'm the founder of Mama's Comfort Camp, which is an international support network for moms, where moms from around the world and across the street support each other in mothering happier. So we're not a forum about how to be a better mom, because you're already a good mom. We're a forum about how to support, how to get emotional support from each other and love ourselves a little better while we're doing the most important job in the world. Today, I am talking to Samantha Lushtak of Absolute EHS, which is Environmental Health and Safety. Sam is an expert in important things during pandemic times, and we are here to talk about about face coverings. We're going to cover as much as we can about face covering, how to and how not to. And I would like to just make sure that everyone understands that this is an informal conversation and that the guidelines of the CDC and your local health department always take precedence. Also, there is going to be a bit of a formal disclaimer at with a description of this video. It's something that we are required to do as a project of the Center for Transformative Action, which is our nonprofit home which is affiliated with Cornell University. Okay, enough with the boring stuff. Sam, would you please tell us just a little bit about yourself and why anyone should listen to you? And then we'll dive into face coverings and what's going on in New York State and everything else.
Sure, thank you for that. My name is Sam Lushtak. I'm the owner of Absolute EHS. I've been doing environmental health and safety work for over 10 years now. I've got a master's in occupational safety management. I am a certified safety professional, a certified industrial trainer, and I am a grand master in safety according to the Board of Certified Safety Professionals. And I'm excited to be here.
How did we luck out enough to have you among us? This is really amazing that, you know, the resources are in the community, and thank you very much for just letting us know that you're part of the community and that you're willing to help and support people's and answer Mama's questions. Because while at Mama's Comfort Camp we're really a lot more about emotional support than practical advice. In this case, in order to feel emotionally supported, we need to have some basis for making the practical choices in pandemic times. So having you as a professional be available and so generous with your time and your knowledge, it's very much appreciated. Thank you so much.
Well, I appreciate being here. I love geeking out about safety and, trying to take a break from the almost 3-year-old who's running around ruling my life. So.
Isn't it so hard? It's just, one of the hardest things about spending all day at home with my loved ones is spending all day at home with my loved ones.
It's like they all came to the office and stayed.
Yeah. Right. Okay, so the reason we're doing this today is that tonight an executive order goes into effect in New York State, and we're in Ithaca, New York, so it's starting to affect us. And I have to say that I'm quite confused about what the order itself says and what it means and what really is an executive order. If you don't mind just going into that a little bit.
Sure. So what Cuomo actually said is, and this is a quote, all people in public in New York must have masks or mouth and a nose covering and must wear it in a situation where you cannot or are not maintaining social distancing. So just to reiterate, social distancing means that we're keeping at least 6 feet away from other people. And what this executive order means is that if you are caught violating it, you can be fined. So you're not going to get jail time, but you will be fined. And given our current, many of us in our economic situations, that's going to hurt. So definitely we want to wear some sort of covering if we cannot maintain social distancing.
Okay, so the first thing that I'm hearing is that if you're going to be somewhere where you can maintain the safe distance from others, then you're not going to be fined if you're not covered.
That is correct. Yeah, so if you're in your own backyard, if you're in a big field and nobody's around, walking on the street by yourself and nobody's around, you're okay. You don't need to wear one.
Okay. So before we go into more details about the face coverings, what's the right one or the wrong one, I wanted to talk about the function of said face coverings. Why are we covering the face? Who are we protecting, and what are we trying to prevent?
Right. So COVID-19 or coronavirus is found mostly in our sputum. So spit, saliva, snot. Those things, hopefully, as far as I know, only come from the mouth and the nose. So if we are wearing what we're more commonly seeing are surgical masks or some sort of cloth covering, it's going to keep a majority, if not all, of a rogue cough or cold, anything coming out of your mouth or nose, contained inside that mask and against your own body, instead of going out into the public and affecting everybody else. We are not going to talk much about N95s right now, because those are something that protects more medical healthcare workers. Today is more about surgical masks and the cloth coverings, and we can talk about N95s at a different time if you'd like. So
the N95s are considered respirators, right?
They would fall into that class. They are, so the 95 is 95%.
And we're not doing that.
You're going to find those in hospitals. If you see them in a store, leave them for people in a hospital, or buy them and donate them directly to a hospital.
Right. So these are best used for healthcare professionals for their protection. Whereas, if I understand you correctly, when we're wearing a fabric covering, we are actually doing a public service to the people that will come across the air that we walked through. And we are keeping that air free of our own saliva or snot, basically. So we are keeping the job of the face coverings is to keep whatever comes out of our mouth and nose attached to us, as opposed to floating in the air that we leave behind ourselves as we walk through, say, the neighborhood.
Well, you're correct, except for one correction, which is it's not airborne. So there's this study, and if you go into it, they aerosolize the virus to a point that's just not, it doesn't really replicate what a sneeze would look like. So we're talking about surface contamination. So I'm going to demo my homemade mask for you right now. So if I'm wearing my mask, I'm going to be protecting you if I were to sneeze, because there's not going to be a lot of sputum coming out towards you if I'm a wet sneezer. But the other thing is, if I touch a pen and then I go to scratch my face, I'm protecting myself from those surfaces that somebody else may have sneezed on. So it's actually twofold with the face covering. Now, while I have this up, I do want to tell you some issues that we have with this type of mask. So one is there's a gap here, there are gaps over here, and there are gaps up here. So it's really not full coverage. Now, some of us have a fancy little piece of metal, so it's actually closing the gap to a certain extent, but it's also really hard for me to breathe. I'm trying to project. I've been fit tested and done all this other stuff, but for most people, that's going to be really hard to wear that for a long period of time, especially if you do plan on going for a brisk walk or a jog in a crowded area. So it can be very detrimental, especially if you are heat sensitive, if you've got any kind of lung issues or any kind of cardiac issues. It's really going to, it's going to force your body to expel more energy, pulling air through however many layers you put into your mask. And that's really, it can cause more problems, because if you collapse due to overheat or exhaustion or anything else, you're now putting our public health workers at risk, and then you're also very likely to become contaminated by COVID once you get to the hospital. So that's just something to be aware of with this type of homemade mask. Now that brings me to, I'm sorry, I'm probably going out of order. This brings me to what I prefer, which is a bandana. If you've never worn a mask, if you've never been fit tested, if you're at all compromised or at risk, either due to cardiac, pulmonary, or just heat sensitivities. It's a mom's group, so if we're going through menopause, we tend to heat up a lot, right? So something like a bandana is going to go around your head, and I've got airflow coming in under here, but it's still covering my nose and mouth. The other thing that I like about the bandana is it's universally accessible. You don't actually have to have a bandana. You could have just a fabric square or something like that. You don't have to go buy one of these. You don't have to know how to sew. You can just have a fabric square. Mine is actually from my wedding, but I just fold it into a triangle, tied it around my head, the back of my head, and it's going to do pretty much the same thing with less risk to people who might have greater risk factors.
Question.
Yeah. Yes.
So earlier when you were showing us the homemade mask, or you were showing us that there's like some gaps coming from here and there's a gap down here, and whether there's a gap or not over here. But then when you have the bandana, there's lots of gaps. There's like a big gap here, but that's not a problem from your perspective. Can you speak to that a bit?
Sure. Okay, so let's come back over here. So my homemade mask, first of all, this one is pretty fancy. It's pleated. So if I didn't wear it correctly, if I hadn't covered my chin with it, it would actually look like this. So anything is going to be right by my mouth. If I open my mouth, you can actually see my, so if it covers my chin, which is how these pleated ones are designed to do, that still helps, but you still have that gap below. So if you were to sneeze rather vigorously, it could, in theory, come out. Now with the bandana, I do have some gaps, but they're much higher than they were. They're much closer to my eye level than it was with the mask that was made. And then this bottom part is far, far below my chin. And in theory, I could tuck it into my shirt if I was really concerned, or into a jacket.
In practice, that sounds like a good way to go. So you know that anything that leaves your mouth will meet your chest, and that's it. Won't go further.
Right, and you're containing it to
stays with you.
The other thing is, if you are wearing a bandana and you have to like scratch your neck or your face or fiddle with your hair or anything, this mask isn't going to protect any more of your body, but this is actually going to protect a lot more. And we're talking about people who aren't used to wearing personal protective equipment, who, you guys might not realize what you're touching. I know I don't, and I've been dealing with this stuff for over 10 years. So it's just an added piece of precaution, and it also allows for enough airflow and ventilation that we're going to reduce any other risks that we might introduce otherwise.
So I think you convinced me that what I want to use for my own use is a bandana. And I don't actually have a bandana right now, so I'm just gonna go and take an old t-shirt and cut a big fabric square out of it and make sure that the bottom goes into my shirt. So I end up tying it around my face, I tuck it into my shirt, and then I will have a lot of air breathing coming this way, but if I sneeze, any spit stays attached to my body. And then if I touched, say, a door handle somewhere, and then I touched my face or I end up touching the bandana instead of my mouth and my nose and my eyes. So exactly. I am protecting other people by keeping all of my wetness attached to my body, and I am protecting myself from any surface contamination that my hands may have picked up, because if I end up touching myself or fidgeting, I am a lot less likely to get the virus from my fingertips into my mouth or my nose or my eyes.
Correct.
That's basically all the face covering is trying to do. It's trying to keep what you have with you and trying to prevent your hands from transferring germs from door handles, pens, elevator buttons, and then bringing them into our own wet openings, which is how the viruses go in to the body, right? Because we're not going to get sick by something touching our skin. We're going to get sick if the virus goes from our skin to our mucous membranes, basically,
Mucous
right?
membrane. Yep, that's exactly
Right.
it.
So could, like, you could get sick from like your fingertip to the eye,
Mhm.
basically.
Yeah. So if you're
Eye,
wearing a
nose,
mask,
mouth.
if you're wearing a mask, you just have to be that point. Since your mouth and nose are covered, you have to be worried about touching your eyes. And I know I wear contact lenses. I kind of fidget every now and then. People who wear glasses, that's another one. But the other thing, just to mention, because we talked about tucking it into the top of a shirt, we're getting to summer months. New York gets really hot. If you're gonna cut fabric, cut it to like mid chin or mid neck, so just below the chin, and that's gonna work as well. It doesn't actually have to be tucked into anything.
Okay, great. Okay, so we've asked our mama members for their questions before this conversation, and we got several questions that seemed to be on the mama's mind. One of them was about exercising, and there's, you know, various ways you could be handling a mask in various exercise situations. So if you don't mind just going into that a little bit.
Sure. So if you are exercising, and again, if you're on your own land, you don't need a mask. If you're running on the side of the road and there's nobody around you, you don't need a mask. That's according to the executive order, as long as you can maintain social distancing. So if you go on one of our many gorgeous trails, or anything like that, as long as you can keep a wide berth from other people who are walking around, so at least 6 feet, you still don't need a mask. Now, putting something in your pocket like a scarf or a bandana, or even if a mask, if you're comfortable and I haven't convinced you, that's probably smart, so that on your walk over, if you do end up at a crosswalk and seeing other people, you have something to wear. Now that said, I think on our mama's group, I saw some people saying they feel suffocated by the mask, or they're overheating in the mask. This is where what Cuomo is really saying is he wants us all to have foresight. So what is it we want to do? And let's think ahead and try to anticipate how many people we're going to run into. So if you know that you're going to overheat, you know you feel suffocated, you should probably pick a different trail or a different open space, or go run, run around one of our many community centers that have all this land, so that you don't have to wear that mask. Now that said, there are plenty of lightweight materials that are used for skiing, for example, or just lightweight scarves or something that you could keep over yourself. Because as I said earlier, if you pass out because you overheat, or if you are putting so much strain on your lungs that it's just not going to work and you're not going to get home, we've got a whole other bag of issues here. And that's really my concern with these homemade masks, and with every other type of mask, is the mask isn't going to cure everything. The mask actually can introduce a lot of risks. And that's why I was so excited to have this conversation with you, so we can address those risks.
Thank you. Now, in our preliminary conversation before we started recording, you mentioned a term that really caught my ear, and I wanted us to just go over it for a second. And I think it was security theater.
Security
or
theater.
Safety theater. So that's a professional speak, I'm sure, but I think that it's. I would really like to have our mamas understand what you meant by that.
Sure. So security theater, it's when you do something that looks just fail-proof and it's going to be awesome, and it's not actually doing a whole lot. The TSA at airports has been accused of security theater a lot. There's a really good Adam Ruins Everything about that if you want to get into that. So the thing with security theater, when it comes to what we're talking about right now, is when it comes to gloves and masks, for the most part, they can be very useful, absolutely. But the problem is that nobody within these executive orders, nobody is executive ordering us to get trained on how to use any of it. So what are we actually doing? If you think about gloves, which is a whole other topic, most people are thinking, oh, I wear gloves, I'm fine. But you're actually spreading the virus just as you would if you weren't wearing gloves, unless you change the gloves every time and wash your hands in between each change. It's the same thing with these masks. So a homemade mask is homemade. There's no standard. The hospitals are putting out what they'll accept, but The CDC hasn't tested them. Actually, the CDC doesn't even test them. Nobody has tested these masks. Nobody has really tested these patterns. People are using fabric scrap that they have at home. And I want to make it perfectly clear. I applaud the efforts, and I think it's great that people are trying to help. But there's also a portion of this which is everybody wants to do something, and there's only so much they can actually physically do aside from staying home. So why not give them a project? So they do have their benefit, but they have to be used properly. And even when they're used properly, they're not as effective as we might think. So that's another reason I'm concerned about the homemade mask, because it's called a mask, but it's not actually doing what we expect a mask to do because it hasn't been calibrated, it hasn't been tested. It's not like the mask you're going to get in the hospital. This is homemade. And
so
that's
think about, so what I'm understanding from you is that all of the handmade masks, we should be really thinking of them more like face coverings in the shape of a mask.
Yes, so it's this is going to be about the same as this, but this, you know what it is. You know it's just a bandana. This is just a bandana that's been cut up and changed, and you know there are benefits. You know, you got a little more. You know, your neck is going to stay cool, and it looks awesome, and you can fit it to yourself, and that's fine. But it's a bandana. It's not a surgical mask, and that's the part that makes me concerned.
And it seems like there's no like 100% way to go about this. And when we are wearing these things, we are definitely adding security. We just need to make sure to understand that there's no 100% security, and you don't know if it's 60% or 80% or 90%, and it doesn't matter. As long as you understand that you're still vulnerable, even when you're wearing these things, you're just not going to be stupid about it. Hopefully.
It's exactly that. What it is, what we're doing here, and what we're doing here with whatever mask you choose, whatever you decide to do, we're doing a risk mitigation exercise. Everything
risk mitigation exercise. I
yes,
like that.
Society.
Less risk, but no 100% safety.
Exactly. So the way safety professionals think is you think of what is the amount of risk, you know, catastrophic to mild, and what's the frequency of risk. If everybody's wearing a mask or a bandana or practicing social distancing, our frequency is going to plummet. Our risk is still high. We still have people who are going to die. But if we all do everything we can and understand what we're doing, the frequency is going to go down significantly. And that's how we're going to flatten the curve and allow the medical teams to catch up with all the cases that are coming through to the hospitals.
Awesome. Okay, I want to make sure that I ask a question that was a very specific question. Kathy, who is one of my favorite people on earth, she's a Mama's Comfort Camp moderator and board member and an avid mask maker, is asking how important it is to have the bridge of the nose fitted with a wire, and how tight does it have to be in order to be effective? Think as she's making masks and also guiding other people in the making of masks, I think this is a very, it would help to explain how to think better about that. So
we've got two different types of clients with these homemade masks, and I think that's one of the questions I'd have for Kathy. If you're talking about the medical professional, they're going to be wearing this mask a lot for most of the day, right? So having that wire is going to be really helpful, mostly for comfort purposes, but also because remember I mentioned that gap over here. If we can make the gap smaller, any kind of particularly wet type of sneeze isn't necessarily going to go up. Also, medical professionals may be wearing safety goggles or safety glasses, and the bridge part really can help with that fit. So that would be more of for a person who's wearing it long term. Now, for the moms of us who are non-medical, non-frontline workers, and we're going to the grocery store, you're only wearing this while you're in the store. You don't need to wear it in your car. You don't need to wear it at home. So you'd be fine without the metal piece for that 30, 45 minutes, 10 minutes in certain stores. And that's, so I know we also have concerns with finding enough metal. I think our mayor actually put out a plea to ask for more wire for these masks. That's another thing we can reserve for the medical professionals. They should get the wire. They're already down to, you know, non-tested homemade masks. Let's give them at least as much as we can that would make it usable and comfortable.
Okay, great. Okay, a question about fidgeting and bringing it up and bringing it down. So say you're going for a walk around the neighborhood and most of the time you're not seeing anyone else, but then you go by, like you said before, is it good to just have it in your pocket or keep it around your neck and bring it up and bring it down? And then if we do fidget with it like that, so for example, with kids who wear the mask and they have a hard time not touching it, what does the touching of the mask as we take it on, take it off, adjust it,
Right.
what does that do to the efficacy of using the mask?
So once it's on your face, it's contaminated. That's it. Even if you haven't gone near anybody else. So like this mask that I've just been goofing around with on this video call with you, this is going to be washed afterward because it's contaminated now, and my hands are contaminated, and the piece of paper I keep putting it down onto on my desk is contaminated. As far as I'm concerned, we need to treat, if we're wearing personal protective equipment, which we call PPE, if we're wearing PPE, we need to treat it like PPE. So what that means is as soon as it comes out of your pocket and touches your face or goes on your face or goes onto a surface that might be contaminated, it is now officially contaminated. So if I mentioned going to the grocery store, I keep these masks, my cousin made these. So she gave them to me in a Ziploc bag. They've been in the Ziploc bag the entire time. When I go to the grocery store, I can put it on when I'm in the car, put it on, get out of the car, go into the grocery store, do my shopping. When I get back to the car, I'm going to take it off. And this is why I like these ties in the back, because I'm going to take it off by the knots, and I'm never actually going to touch the mask part. So my hands can stay clean relative to the mask at least, and put it directly back into the Ziploc bag. When I get home, I'm taking that Ziploc bag straight to my kitchen sink, and I'm putting the masks in the sink to wash them with soap and water and then line dry. I personally would not put these in the washing machine, especially the homemade type. I think the bandanas would probably be okay. But with these, the fabric can be compromised, the stitching can be compromised. You already need to assume that it's compromised just because it is homemade and doesn't have a specific standard. So these should be hand washed with soap and water. And remember, vinegar doesn't do anything.
So when you say soap and water, do you mean I should be using just like a little bit of the Dawn dish soap that I have in next to my kitchen sink and like putting it in a clean bowl and like sudsing it and then like washing it, dunking it until the water runs dry, I don't know, lost my words. But basically just in the sink, and any kind of soap would do. It could be hand soap that I have next to the sink, or it could be the dish soap. Anything goes, basically. Absolutely. As long as it has the capacity to break the fat, the fatty and the, what is it, the water loving and the fat loving. Yeah. Sam has a wonderful little video about how soap and water destroy the viruses and bacteria, and we should link to that in the description of this video. Can you do that?
Yeah, we can do that.
Thank you.
We can definitely do that. But yeah, so any kind of soap, the only caveat here would be if you are allergic to fragrances or otherwise sensitive, this is going over your nose. So you want to think about that ahead of time. And if you have any kind of dermatitis type reactions. So for example, I am allergic to Dial hand soap. I have no idea why. So I wouldn't use Dial on something I'm going to put on my face. I can use it on my hands, but not on my face. But I can use, you know, whatever I have by my kids, like Dawn is fine with me. So, you know, you have to know yourself and make sure it's actually soap.
Okay. So this just brought me to something that I was wondering about yesterday that is kind of sort of maybe related. I remember that when I was a child, the soap packages often said soapless soap. Do you know about that? And then that's gone. They're not doing that anymore. Does that ring a bell?
I have not seen soapless soap, but I know my mother uses some kind of shampoo called no poo shampoo, and it like doesn't lather.
Right. So I don't know if it's the same thing, but basically I think what I understood from watching your video about soap is that you really have to have the lather, because that's the part that breaks the structural integrity of the viruses. So make sure that we use soapy soaps.
The lather is really just a good visual indicator. The lather is not actually doing a whole lot. It's just showing you that you've oxygenated the soap enough to make bubbles, which means you've gotten enough friction in there. So the lather, I can't, to be perfectly frank, I cannot speak to the lather specifically. I would imagine it has to do with some hydrogen bonding and the water reacting with everything else. But, you know, any kind of no poo shampoo or soapless soap thing, I'm happy to look at ingredients lists and help anybody out.
Don't worry about it. Yeah, that was just me going on a little tangent.
That's a good question.
Yes, if any of our mama members or viewers know what I'm talking about, just write a comment.
Yeah, please do. Speaking of comments, there was one comment about beards, and I really wanted to talk about that briefly.
Yes.
If you have a beard, you do not need to shave it. The reason that the news really latched onto that is because they were looking at fit testing for N95 and higher. And for that, this whole area needs to be clear to make a seal, which means you have to shave your beard or your mustache. For the bandana, for everything else, we're keeping things contained against you. Your beard is okay. Now, that said, if you do test positive and you're sneezing and getting all this gunk in your beard, you need to be aware that that is an appendage to your body in a way that needs to be cleaned with soap and water regularly. And make sure you don't, you know, snuggle the dog, or, you know, kiss anybody or rub your beard on anybody. So just acknowledge that's more of a catch. Which can be disinfected just like everything else.
Okay, so I think we have gone over everything. Once again, I feel like I learned from you so much, and I also feel like your presence is calming and reassuring, and I'm so grateful for that. Sam told me before we started that she would be actually very happy to do an open live Q&A with us in a video chat maybe next week, and we could go over your questions about masks and face coverings, or if you have questions regarding our previous conversation video chat, which was about kitchen safety and disinfecting produce and things that come from out of the house into the house, etc. So we will be opening, we'll start a thread for finding a good time to have people join us. Yeah, that's it from my end.
Can I add one clarifying comment really quickly?
Yes.
If you're making masks and devoting your time, your energy, and your materials, I applaud you. Keep doing it. This information session was more toward the, I call us laymen, but the non-medical, non-frontline worker. So those frontline workers still need these donations, and everybody else who is not trained to wear a mask, not familiar with personal protective equipment, this bandana conversation is directed at all of us.
Thank you.
Thank you.
Okay. May we all continue to be well and healthy. May the crazy time be over soon. May all beings be happy and free. Thank you so much, Sam.
Thank you so much for having me.
Always.